Good afternoon, everyone. I am truly honored and privileged to be here today with a person who's truly a legend and a saga in neurology, Dr. H.V. Srinivas. Welcome, sir. To my mind, Dr. H.V. Srinivas has always been a teacher par excellence, who has always shaped the future of his students with a sparkling and witty teaching. Sir is also renowned for a lot of academic and social work, especially in the community aspects of epilepsy. So let us spend this afternoon with Dr. H.V. Srinivas, getting to know Dr. H.V. Srinivas well. Welcome, sir. Sir, would you like to tell us something about your childhood and your past at first?
I think before that, I must thank IAN for this wonderful program of talk show where the earlier presidents and senior neurologists of academy have been given an opportunity to share their life's important points and also the academics. So I think I once again thank the IAN, in particular, Dr. Nirmal Surya, the president of the association now. And I also thank Sujit for those kind words for me to start off today's program. Well, regarding the childhood, you said yes, very right. I think those of you who know a little bit of Indian history for independence know the date 9th August 1942, a very memorable day, which is called as a Quit India movement, wherein Mahatma Gandhi and the Congress has told the Britishers to quit India. So it so happened, I quit the uterus of my mother and I was born in this world. So that is 9th August 1942, very easy to remember. My father was a reporter, a journalist for the Hindu newspaper, and I was the eldest of the 6 siblings. You can see a lot of siblings here in photo. And my father and mother tongue is Kannada, but I was born in Kurnool, and so there it was the Telugu medium. So educated in Telugu, entire schooling with a mother tongue in Kannada. So in 1956, state reorganization took place where India was divided into states depending on the language. And so at that time, Bombay was divided into Maharashtra and Gujarat. So similarly, Mysore was merged into Karnataka, and Gulbarga, which was in Hyderabad state, was merged with Mysore as Karnataka. So the net result is that my father was transferred from Kurnool to Gulbarga in 1956, November. I had already joined my intermediate in Kurnool. In November, I shifted to Gulbarga, but there they had already started PUC first year. At that time, PUC was 1-year course. And I was too late to join 1-year course because March is the examination. And so a conference between my father and principal resulted that I should take off 1 academic year. Anyhow, I was underage, only 14 years, and I was still thin, and I should pick up my body and all that. So I lost my 1 academic year. And then the following year, I joined PUC. And then the question of further progress happened on its own. The progress was, my father was very keen that I should join BSc and become a teacher in Arts and Science College, because I will have a lot of holidays to enjoy. And for my thin personality, that would be the right thing. And I never thought of any medical course or becoming a doctor. I was too young and there was no social media to influence me also, neither any of them. So I joined BSc first year and I was going along. Suddenly one evening, my father came back and said, tomorrow you go and join pre-professional course leading to medicine. So I was stunned. I said, what is this for? Where will I go for medical college? He said, we will find out. You have to go to Hubli for MBBS, but now you join. Later, I learned that my father's friend had a chat with him. He said, look here, you don't get any pension after you retire, and you have 6 children to look after. So at least the eldest one should be able to earn some money to run the family. So somehow or other, you must make him a doctor. So overnight, the luck changed. Then I joined the pre-professional course in medicine in Gulbarga. And subsequently, I stood 3rd in the rank for joining the medical college. So I joined medical college Hubli. That time it was known as Karnataka Medical College. I was the third batch student in that. That is how I joined MBBS, sheerly out of circumstances and luck, I must say.
So, sir, that is how you decided to become a doctor. How were your undergraduate days, sir?
Very silent. I was I was an introvert. I would say that bookworm, and I was keeping to myself only most of the time. And when I stood first for the university in physiology, actually the physiology professor asked, "Who is this Srinivas? Stand up." And then I said, "Oh, you are the one who got first in the university." So I was so unknown in my college undergraduate days. And then we had a posting in a primary health center during our internship. We were posted in a small village. And what was most shocking was when we were supposed to spend there for 3 months, there was no toilet in our building at all. And we were asked to take a chambu and then go to the field to relieve ourselves. So that was a real experience, I must say, bad experience, I should say that. And then subsequently, our batch used to meet once in 2, 3 years. So we all met here. One of the recent photographs which you can see, where 1959, 63 batch was there. So all of us have now become grandparents. So when we meet now, we don't talk about girls and girlfriends. We talk about what your grandchildren are doing. So that is our age group now at that time. So that is how about our MBBS program.
So how did you choose to become a physician and how did that materialize?
Well, during my MBBS course, somehow I got fascinated in medicine and in particularly the physiology of nervous system. So I decided that I must do post-graduation in medicine. So I came back to Hyderabad. By then, my father was transferred to Hyderabad. So I told him I want to do an MD general medicine. He said, no, 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 you can't do it. We have already got enough loans for you to do MBBS. So you finish off the payment and then you can go, but don't ask me any more money after you join MD. I said, okay. And very casually, Secunderabad, we had a divisional railway headquarters. I casually just stepped in there and I met in the office somebody there. I said, I am so-and-so. I just finished my MBBS. I'm looking for a job. To my surprise, he gave me a blank paper. He said, please write here and come and join from tomorrow. It was so easy at that time. So I was shocked, very pleasantly shocked, I must say. So next day I went and joined. Then I realized the fresh doctor is not going to stay in the hospital there, but he's a relieving doctor for mofusal places. Suppose there are small places where there is a railway clinic is there. If that doctor goes on leave, I'm supposed to go and relieve them. So 20 days in a month, I used to be outside Secunderabad hospital. But the good part of that is being a railway doctor, we were allowed to travel in first class. So to travel in first class train at that time was a real big thing. And a railway doctor is supposed to inspect the railway canteens on the platform wherever there's a junction. So whenever there is a junction, the railway canteen people used to come search for me and then give fresh coffee and all that. So that VIP treatment at that young age was really fascinating. So I really completed my 1 year term there. Though there was a pressure from the railway hospital and from my father to continue there, I was determined to do post-graduation in medicine. So at the end of 1 year, the railways, they give you a pass, first class pass to travel anywhere in India. So some of my friends were in Pune and Ahmedabad doing post-graduation. So I went to Pune, I got a seat in MS General Surgery, which I declined. Then one of my friends was in Ahmedabad. So I went to Ahmedabad and he introduced me to the professor of medicine. So he said, okay, come tomorrow and join the residency program. Then I came out and I said to my friend, I have come here to do MD. I have not come here to do residency. He said, no, no, look here. The plan here is once you become a resident doctor, you automatically enroll for MD. So it was so easy to get into MD that time. So I did my MD general medicine. Looking now, there's so much of competition and all. So I got a job in railways just like that and got a MD seat just walking like that. So my post-graduation medicine started there in Ahmedabad.
So when did you decide to join neurology? Was it your preferred branch post MD?
Well, after my MD medicine, I came back and to Gulbarga and joined the newly started medical college as a lecturer in medicine. Then after 3 4 years, then I start thinking. Everybody at that time was a cardiologist. The joke was every physician is a cardiologist until proved otherwise, because the cardiology was the flavor at that time. I was somehow attracted to neurology, the analysis of neurology case and all that. So I wanted to do neurology. So I was looking for a neurology post-graduation, but the college said that you have to work for 5 years and then we'll give you the leave. So at the end of 5 years, when I was an associate professor in medicine at that time with a unit of my own and assistants and residents, I left all that and joined JJ Hospital Grant Medical College for DM Neurology. I was very much thrilled to be trained by the stalwarts in clinical neurology, my gurus, Dr. Wadia and Dr. Singhal. And it was a really very fruitful time which I have spent there during those time in DM Neurology. And I was also fortunate to have two more colleagues. Ours was the first batch of DM Neurology from Bombay University. Myself, Dr. Bhatt and Dr. Katrak. Dr. Bhatt, of course, he left and settled in USA. Katrak, as you all know, that he later on became emeritus professor in Grant Medical College and also emeritus head of the department and professor in Jaslok Hospital. Very recently, he retired. Right now, he is enjoying his time with his children in Sydney, Australia. Incidentally, my daughter is also in Sydney, Australia. So we had a good time there. The only problem was, this is my guru, the first teacher who really inspired me for clinical neurology, Dr. Wadia. And one of those visits to my house here in Bangalore, along with his wife. So this was in my small garden in my house, where we had a good time chatting with each other. And this is my friend, Sarosh Katrak, whom all of you have known about him. And we were very good friends. And the only negative point of that period was, you see, I was an associate professor, a family life, home food, everything was there. From there, I had to stay in a hostel with a hostel food. That was a little negative point, but it was overshadowed by my friends and my teachers training me in neurology. This was one of those batchmates. All of us met with our teachers. You can see Dr. Wadia, Mrs. Wadia, Dr. Singhal and Katrak. So all students of Dr. Wadia here in one of the 19th formal training in 1970s. Then subsequently, after my finishing neurology, I came back to Gulbarga, continued as associate professor in medicine and trying to establish neurology department. Remember, those were the days when there was no CT or MRI. It was purely clinical neurology with invasive many investigations like carotid angiogram and PEG and all. So my wife, who is an obstetrician, she's an honorary to the medical college, and she had started a nursing home. So both of us thought we have settled in life now. I was a full-timer associate professor, and my wife was an honorary assistant professor with a nursing home. But the future had something different. There was another twist in the story there. Subsequently, around that time, I think 74, the NIMHANS was formed, merging the All India Institute and the mental hospital together. And Dr. Mani, professor head at that time, was looking for some young neurologists to join NIMHANS. So it so happened Dr. Wadia was his friend. And when he inquired with Wadia, he said, look here, there is one Kannadiga fellow from Gulbarga who has just finished DM. So why don't you rope him in? So Dr. Mani came to Gulbarga and he started talking to me and my wife that I should join NIMHANS. I flatly refused. I said, sir, we are well settled now. My wife has started a nursing home, so no question of relocating once again. He went back, but Dr. Mani doesn't take no for an answer. So when the newspaper there was advertisement for various posts in demands, he sent me the advertisement to apply. I said, I won't come, I won't be coming. I don't want to apply. Then he sent me an application form. Then he sent me an interview letter. Again, I told him, sir, I am not able to come because my wife has got a nursing home and all. Hey, Barapani, you come to the interview. So in the interview, he said, look here, you're already an associate professor, but you have no teaching experience in neurology. So you have to start as a lecturer in neurology. I said, I don't mind the designation, but I'm ready to come now, but my wife has to be relocated. He said, that you don't worry about it. And he said, another thing is, we will give you the pay scale of an associate professor and the quarters of associate professor, but you will be called as a lecturer in neurology. I said, no problem. So that is how I have been roped into NIMHANS. Without my knowledge, things took a turn for the good, of course, I must say that. So that is how I joined NIMHANS, and myself and Dr. Gauri Devi were the first appointees from NIMHANS. She joined as associate professor, I joined as a lecturer, and we both were the first appointees for the NIMHANS at that time. So 1976, that is how I joined. Then I thought the life is settling down because my wife got a job as assistant professor in Bangalore Medical College, and they are allowed practice after the office hours. So I thought she will be doing the practice and I can continue as a full-timer, and Dr. Mani being a second mentor of that. But again, there was a twist in the life.
Sir, what circumstances led to you leaving NIMHANS, knowing your flair for teaching?
That's what I said. There was another twist in the story. After Dr. Mani brought me to NIMHANS from Gulbarga, 2 to 3 years later, he left NIMHANS for his personal reasons. It was a very disappointing and disheartening time for me, because he's the man who asked me to come, and I was very happy to work with him and very happy to work in an institution like NIMHANS. But after he left, it was a little disappointing, but I continued. But then what happened, my wife was not interested in practice. See, OBG means so much of practice can be made, but she was not interested. And the pay scale was, at that time, was only 3,300 rupees for an associate professor. So though we were comfortable at that time, looking forward to have a house and education for children. So in one word, purely for economic reasons, I had to leave NIMHANS. It took 1 year for me to take this decision, very disappointing decision for me, but it had to be taken. And at that time, something like a herd community, herd psychology, all of us, 4 of us left simultaneously, all for economic reasons. Myself and Sagar from neurosurgery, Kalyan Sundaram from psychiatry, and Dr. Deshpande, neuropathology professor. So all of us left because of economic reasons. So that is how I started my private practice. And Dr. Mani, who was already in practice, he was pulling my leg. Look here, you are the first DM neurology candidate to practice full-time in Bangalore. And I don't have DM neurology. You're a real qualified neurologist. That is how he used to pull my leg. And I remember at that time, my consultation was 50 rupees. All other physicians were charging 30 rupees. So they were saying, Yenappa, you are such a big man, is it? You are charging 50 rupees at that time. Anyway, what happened afterwards is my association with Dr. Mani. Dr. Mani involved me. Yeah.
Please tell us about it. So it's very interesting to hear about it.
So Dr. Mani was responsible for me to get into Indian Epilepsy Association. So headlong, I went into the Indian Epilepsy Association, the Bangalore chapter, as well as the national body, and for a short while in the international body. So we were totally involved in IEA Bangalore chapter activity. And as you know, one of the important activities was about the Elandur Rural Epilepsy Project. Now, this is the brainchild of Dr. Mani. So we had 2 teams. Dr. Mani, my second mentor after Wadia. So very strict man, and we used to have this Elandur project. Now, what you see in the photo is one of the Elandur project team. So Dr. Mani and Geeta Rangan and one more person was one team, and myself, as you can see here, Krishna Reddy and Kalyan Sundaram, is the second team. Every alternate day, we used to visit villages in Elandur Taluk. There were 35 villages. We did house-to-house survey of 65,000 population. Alternate week we used to go, and all the expenses were borne by us only, not by Bangalore chapter, not by any pharma company. So we finished the house-to-house survey over a period of 1 year, and then followed them up for the next 4 years, starting with the phenobarbital phenytoin as the anti-epileptic drug. And we were able to log on to the Corona Trust there. They used to supply home delivery of leprosy and TB drugs. So we also started delivering the anti-epileptic drugs to their respective places through them. So it was a very fruitful activity, I must say, the 5 years. And the result of that, you have seen that phenomenal work has been published in both Lancet Neurology and as well as a seizure. Especially the epidemiological work is oft-quoted whenever we talk of epidemiology of epilepsy. So that is a Elandur study is a very often quoted work. Now, apart from the Elandur study, I was also involved in various other activities of IEA Bangalore chapter. And one of them is Dr. Mani's pet project is to take children with epilepsy to camps. So we used to have camps, epilepsy camps, where we used to take children with epilepsy without their parents to infuse confidence in parents that they can allow their children whose epilepsy is well controlled to mix with others. So this is one of those camps we used to have Dr. Mani and Dr. Kalyan Sundaram sitting there right in front, and some other camps were there. So that was about the IEA Bangalore chapter activity. Then I was also involved in the IEA national body, the IEA central office. I started off as a executive committee member, and then treasurer, secretary, president-elect, president. So overall, I was in the organization for 20 years plus in Indian Epilepsy Association, and with the guidance of Dr. Mani and with the association of Dr. V.S. Saxena, who is no more now. I think we ran the association for nearly 20 years. So that is the Indian Epilepsy Association national body. And what we did there was two important things. Dr. Mani was able to repeal the marriage law, allowing patients with epilepsy to get married and not divorce as earlier it was there in the law. So the next thing we wanted to get the driving license for persons with epilepsy whose seizures are well controlled. As you know, all over the world in advanced countries, including Singapore and all, if a person is seizure free anywhere from 6 months to 2 years, they are officially given a driving license, even when they are taking anti-epileptic drugs. So the next project was to get the driving license for persons with epilepsy. So this was started somewhere 15 years ago by me. It is still not reaching the correct office there because it has to be passed in the parliament. And you know that parliament is too busy with so many other activities that they have no time for attending to this. Another thing which we started was a diploma in epilepsy care with Bangalore University. The idea was to spread the correct information about epilepsy and dispel the myths and stigma to the general public.
Sir, I learned that among PG students in medicine, there's a saying that if it's Wednesday, it is.
Pardon? Anything?
I'm sorry, sir.
So we tried to, we started off diploma in epilepsy care, a 1-year course program, so that people, teachers, nurses, EEG technicians, they can have this add-on qualification to get an insight into the social aspects of epilepsy. I think it ran for about 4 to 5 years, but then there were no takers, so we had to close down that because everybody who wants to apply for diploma in epilepsy care, they wanted to know the whether they will get a job opportunities. I said it is not a job opportunity education, it is an add-on information. But anyway, that got closed. So at the national level, we are still trying for the driving license, and the diploma in epilepsy is closed. And at the international level, for some time, I was a chair for Southeast Asian region for International Bureau for Epilepsy. And I conducted one camp, one satellite meeting in Cochin at that time with the IBE members and IBE president. There's one more photograph of IEA Bangalore chapter, where the cricket team had come to in our stadium, your continuous stadium. So with the help of Dr. Satish Chandra at that time, so we managed to get the cricket team interact with the IEA members. So this is one such photograph with all the stalwarts in the cricket, where the IEA members immensely enjoyed to meet the cricketers of that fame.
So there's a saying among PGs in medicine and neurology that if it's Wednesday, it is Dr. HVS's class. Would you like to tell us something about that, sir?
Somehow, right from my undergraduate days, I was very much interested in teaching. So during my undergraduate days, my friends, I used to explain to them the difficult topics, particularly the physiology of nervous system and all that. So the teaching has been my passion. So even though I was no more officially a teacher after my resigning from NIMHANS, on my own, I started every Wednesday, 6 to 7:30, postgraduate classes in medicine for both MD and DNB. And I'm very happy to say that right from 82 to today, last 40 years, the classes are going on uninterruptedly every Wednesday. So that is how the students of general medicine, and some of them were DNB, neurology and all. So they say that Wednesday means it's HVS class. And the main reason for my class is to dispel the myths about neurology. Because all of them, they think, oh, neurology is very difficult. Neurology is very difficult. So I wanted to make them understand neurology is like mathematics. If you go stepwise properly, it is very easy to diagnose. So during the pandemic period, where there was no physical classes, I conducted the classes online also. So online, my clinical case discussions and lectures have been recorded, and all these are uploaded into the YouTube under the heading of Dr. H.V. Srinivas, Neurologist. So there are about 40 such YouTube both lectures as well as clinical case discussions which are being accessed. So I still continue. I mean, yesterday we had another class where about 40 students had come. So I think that's my passion is continuing.
Well, I myself have attended several of your classes, and I particularly remember how I learned gait from you. I remembered you walking and showing us different types of gaits by yourself: the Parkinsonian gait, the high stepping gait, the antalgic gait, and you had this unique way of teaching where you would never forget what was being taught. Coming to the next thing, sir, I would like you to tell us about your publications, awards, and honors. And with your basic interest in clinical neurology, you actually penned a book called A Primer for Clinical Neurology. Could you tell us something about this, sir?
I think this clinical neurology made easy. See, that is a word I have used, made easy, because everybody thinks neurology is very difficult subject, very difficult subject. So this is an outcome of my Wednesday classes. So when I interacted with students with so many questions and interaction, then I found that why not I put it in print, what I have been teaching on Wednesday. And so this is the outcome of that. And I'm happy to say that clinical neurology will not disappear, hopefully. And so this book will be relevant for ages to come. It is not like books like on epilepsy or MS or Parkinson. After 5 years, you should have another edition, because there would have been some more scientific advances by that time. But clinical neurology is what it is 100 years ago, and it is same even today. And especially clinical neurology emphasis is more today, because the concept is that do a scan and you will get a report, and that is the final diagnosis. Now, that is exactly what I want them to understand, that clinical neurology has not disappeared. It is in fact more relevant today when all sorts of positive and negative things are coming through with the investigation. So that is my, I must say, the most important book. I have not written any books so like that, but this is one important book I have done it. Then this was the time when there were very few neurologists in our country. And I thought that physicians must have some insight into the correct way of diagnosing and treating some common neurological disorders. So we had a supplement of Annals of Academy of Neurology, where the common neurological disorders diagnosis and management. I was the editor there. It was released in one of the IAN conferences by my first mentor, Dr. N.H. Wadia here. Another important thing I would like to bring out is when I was a president of IAN and also president of IEA, I thought of bringing out a book of historical interest, how the association was started, what was the aims, how did it develop, who were the stalwarts who developed it in the initial stages, and where was the conferences and where was the meetings, where was the branches. So the entire gamut of information, right from the conception to the 2013 when I was the president there, has been formulated into a book. And I requested all the presidents, like what we are doing now, the talk we are going to do now, all the presidents to write about themselves in their words, like what you are telling now, the student days and how they came out and all. And it was a Herculean task, no doubt, requesting people to write. Many of them were quite busy in their practice. They had no time or inclination. But I must say that ultimately everybody agreed, and we have the biodata, biography, and all the literature and the various conferences, various awards, various orations, everything has been put in to two different books, one for IEA and one for IAN. And I am very happy that both the books are available on the website. So this is again of historical interest. Next generation, following generation, when they want to know what is Indian Academy of Neurology, where it was started, immediately you can go to this book and get the information. Earlier, Dr. Nair from Trivandrum had done this for Neurological Society of India. So I took his help also to get these things done. And from our association of IEA Bangalore chapter, Dr. Rai, one of the editors here, he had an idea to have a handbook on epilepsy for physicians, which we released in one of the physician conferences. That is one of the books for me to edit. But my important three contributions is for students, clinical neurology, for historical interest, these two books, A Saga of Indian Neurology and Indian Epilepsy Association, both edited by me.
Sir, we would like to know something about your various orations and felicitations.
Nothing much. From the national body, I had two orations. One is the Bajoria oration in 2002 for social aspects of epilepsy. And then one is a B.M. Sharma oration. B.M. Sharma oration, you know that his son is a C.M. Sharma, who was a treasurer for Indian Epilepsy Association when I was the president. Unfortunately, he passed away at a very young age. His father, B.M. Sharma oration was done. So these are the two orations at the national level. And I had quite a few at the regional level, both in Bangalore Neurology Society, where I had a case money oration delivered. That is Dr. Verma and Dr. Hegde standing there at that time, the president of BNS there. So we had some more orations delivered by me to, again, in Cochin, Shimoga, Tirupati. They're all in the regional orations, but there are two important awards from the national body and one from the physicians API here. So talking about, I think, just talking about the association. See, I was immensely involved in Indian Epilepsy Association, national and central office. But there's another thing which I started. 83, I left NIMHANS, and at that time, there are only three institutions, NIMHANS and Bangalore Medical College and St. John's, which had a neurosciences specialist, that is neurology, neurosurgery. So I thought we should all meet together for a clinical case discussion once in a month. So 83, we started what termed as a neuro club. So it was a very informal gathering, no organization of a president, secretary and all. And I was the only fellow who used to run around, make people as members and ring up people, say, please present a case. Because there are only three institutions and one private practice. So the colleges and the NIMHANS were requested to present at least twice in a year for a clinical case discussion. But now, as you can see, there are more than a dozen people waiting to present cases. So now it is the other way around. At that time, we had to request people to present cases. So in Bangalore Neurology Society, the Neuro Club matured into Bangalore Neurology Society in 94. That is 11 years after starting. And after starting Bangalore Neurology Society, I was the secretary there another 4 years. So I have served at least 15 years, the Neuro Club and BNS, single-handedly for the first 10 years. So 20 years for IEA, central office, and about 12 to 15 years for the BNS. So BNS also, we started a KS Mani oration and RM Verma oration, alternate year. So here you can see the first KSM oration was delivered by my first guru, Dr. NH Wadia. So it was named after my second guru, that is Dr. KSM, which you can see here, the BNS did. So apart from BNS and IEA, I was also the founder president of Karnataka Neurosciences Academy, because as the number of neurologists, neurosurgeons increased in distinct places, so we thought the state should have a meet where we can all have a conference and a clinical case discussion. So Karnataka Neurosciences Academy was started in 2010. So I'm associated with various associations. So maybe I was having a flair to do all the organizational work. In addition, I was also deeply involved in some of the trusts, the IEA 18th IEC Trust from Delhi, where myself and Saxena were the main trustees for a number of years. Plus locally, we had some more trusts here. This is Dr. Saxena, who was my close friend and a guide for Indian Epilepsy Association Central Office, and also in the IEA IEC Trust. So unfortunately, he succumbed to the COVID infection recently. So this was the one which I said as a chair for Southeast Asia region of International Bureau for Epilepsy. We had a satellite meeting of IB organized by me at Cochin in 2011. So at that time, we had the chief guest, Mike Glynn, who was the president of IB, the worldwide body at that time.
Sir, would like to ask you if there are any instances or any incidents that you would like to recall and share with all of us.
Sure, all of us have some unforgettable incidences in our life, some good, some bad, like that. So I may quote a couple of them incidences. The one was a very funny incident, I must say, is as I told you, I stood third in the pre-professional course in the medicine leading to MBBS. So my name was third in the list of admissions in Karnataka Medical College, Hubli. So we were all waiting there for our names to be called. You have to go and show the original marks card and other things. So my number is 3. So I was waiting. 10 number is over, 15 number is over. Still my name was not called. Then I went and met the clerk who was calling the names of the students. I said, I'm waiting here and you have called everybody else's name, but what about me? I said, what is your name? I said, HV Srinivas. Then he said, there's no HV Srinivas, you have not got a seat. Go. I said, how can it be? So I showed him the letter. He said, you are not HV Srinivas, you are Hindupur VS. I was shocked because I never knew. My name is HV Srinivas, but I never ever thought of H as my name. So in North Karnataka, Srinivas is the first name, but they all call by this surname, Patil, Kulkarni, like that. So here there's no Patil Kulkarni for me. So they took out the H as my surname. So he called Hindupur, Hindupur like that. I didn't know that my name is Hindupur. So that was a very funny incident. And that resulted in my attendance register also, I am called as Hindupur VS. So throughout my undergraduate days, I am known as Hindupur. Only I struggled to make me as Srinivas in subsequent this thing. I purposefully, everybody said I am Srinivas, Srinivas like that. So that was one funny incident. Then one medical incident was again in Yelandur. So you know that Dr. Mani described the hot water epilepsy, reflex epilepsy for the first time. It was published. And we had one couple, elderly couple coming to OPD there in Yelandur. So where the history showed that the patient, the husband had a hot water epilepsy for nearly 10 years. Those times we used to treat febrile seizures for 5 years, till the age of 5 years or 5 years without seizure with phenobarb at that time. Now retrospectively, it looks so criminal to treat a young child with phenobarb. Now we don't treat febrile seizures like that. Hot water epilepsy also we used to treat continuously for 5 years. So when we asked the wife, I said, why you have not brought him earlier? Would I given the treatment? So she gave her native intelligence answer. She said, sir, why do you want treatment from you? I know how to treat. I said, how? So I know there's a bucket, there's a water. He starts pouring the hot water on his head. And as the speed increases, pouring on the hot water, I pull out the bucket. So he won't get the attack. So that was our answer. And you know that in hot water epilepsy, there is a pleasure feeling is there. So they go on pouring more and more hot water because of the pleasure feeling which they get. So now we also don't treat hot water epilepsy continuously for 5 years unless they have a seizure in between. So I think that was a very fascinating answer and a very practical answer by her. And the third one is something like out of the Hindi film like. We had gone to New Zealand for a trip and we were in the tourist bus. It had stopped for a coffee time there. So for about 15 minutes. And my wife was trying to do some shopping, small trinkets and all that. So the time was over and the bus was about to start. So the conductor said, get in. But you know that Indian women, they don't bother about time. She said, coming like that. So the bus started. And I was waving the hand to the driver. He was seeing me, and both of us are running behind the bus in one of these places in New Zealand. And all our luggage, passport, money, everything was in the bus in a godforsaken place. We are stuck there. We were running there. We don't know what to do. And just like in a Hindi film where a hero comes to the rescue of a heroine, some jeep came behind and then he asked, what? I said, we want to catch that bus. I said, jump in. So we got into the bus, the jeep there, and he overtook after 5-6 kilometers because the driver was not ready to stop. He wanted to teach a lesson to us, but what is called as a time factor. And he doesn't know that what India is, you see. So the jeep overtook and stopped. And then the driver was shouting at us that you should maintain the punctuality, this, that. Anyway, that was really amazing how a totally unknown person came in and asked us to get in. And so these are the three incidences which I would like to quote here.
There's something about your family and your hobbies.
Hobbies. Yeah, I will tell you about the hobby in one sentence. In one of the conferences where I was being felicitated, I was on the stage and my wife was sitting in the front row. So as I was being felicitated and they were telling about me, she came on the stage and she said, I am Dr. Srinivas' third wife. I was shocked and also pleasantly wanted to know who is my first and second wife. His first wife is neurology, his second wife is neurology, and I am the third wife. I think that summarizes the hobbies. No specific hobby at all, which I think should have been there. Now that we are retired, we don't know what to do. So this is the photograph of myself and my wife then and now. My wife is a Now she is retired professor of OBG from Bangalore Medical College. And we were classmates right from pre-university days. So right from pre-university days, we were classmates, but we got married after MD. Both of us finished the MD and we got married. So in between, she had gone to Gulbarga and I was in Hyderabad, but we met again in Ahmedabad during our post-graduation days. So now she is retired. Surgeons retire very early. You see, physicians don't retire. Physicians don't retire unless they start having dementia, but they won't know that they have dementia. So somebody has to tell, come on, we stop practicing. And I think we continue to do that. She's very much interested in hospitality and cooking and gardening. So she's taking care of all other important factors after leaving her profession now. We have two children, one son and one daughter. Now the son is Sachin, and here you can see he is with his daughter there in California, and he is working for some ADM company as a global strategy consultant. So I don't understand all those things, but they are all settled there. On the left, you see my daughter, her husband with two children. They are in Sydney, Australia. Both are architects. They have started their own firm. And so, as you can see, one child is in the west, another child is in the east. Now we are in the center. And because I was interested in so many organizations, founder of so many organizations, and I have so many of my classmates and friends who are alone here and children are abroad. So jokingly, I used to tell them, I think we should form an association, Physically Abandoned Parents Association. So we're all abandoned parents, but physically, emotionally, they are there because we keep chatting on the WhatsApp and all that. So Physically Abandoned Parents Association, I think one more association I may start. I will have enough number of members at that time.
So finally, what would be your message for the younger generation of neurologists who are coming out? With your vast experience.
There is only one message which I keep on shouting every Wednesday to my juniors. Clinical neurology, clinical neurology, clinical neurology is supreme. Today it is more important because you are misled by the investigations. You and I have seen patients with right hemiparkinson diagnosed as cervical spondylotic myelopathy and operated. Just because they don't examine the patient, they don't see the patient, they don't hear the history of the patient. So I keep telling them that you have a lot of investigations, a plethora of investigations available. And you ask for a MR, lumbar spine and complementary from head to toe. So they think they have finished neurology assessment, which is not correct. And I give them examples, common neurological problems, headache you take. There is no investigation to know what type of headache. Epilepsy, there is no investigation. All movement disorders, there is no investigation. And dementia, there is no investigation. All are clinical. I keep on telling these common neurological is clinical. Clinical neurology is today more relevant. At that time, our time, that was the only thing which was there, so it was relevant. Now it is more relevant in spite of the plethora of investigation. I think that is the only thing which I keep saying. History and clinical neurology is most important. The other thing is when they prescribe medicines, they should know the socioeconomic conditions of the patient. I see time and again as a knee reflex action. The moment there is a seizure, levetiracetam 500 mg BD. 14 rupees a tablet, 28 rupees per day for next 2 to 5 years. Patients who are rickshaw drivers, casual workers, they come and cry, doctor, we are not having our night meal because we want to give our child the proper treatment. You and I know that the primary drugs are more efficient as anti-epileptic drugs than this. They don't even look, ask them what is the cost of the drug which you are prescribing. They don't know. So I think these are very important points. And to quote William Osler, so treat the patient who has the disease. Don't treat the disease which the patient has. I think these are the important, everybody knows, but I want them to practice it. And finally, to conclude, I must say, you see, Usually the student has to wait for the examiner to know what questions he will ask, whether I have answered correctly or not. So in this case, the student has appointed the examiner, Sujit Kumar, and given him the questions, what he should ask me. So I think I have passed the examination conclusively. Thank you, Sujit. Thank you very much.
Thank you, sir. We had a most illuminating afternoon with you about your life and times and the various times that you've gone through, the things that have inspired you. Finally, you've given us a very inspirational message for all of us out there who have been your students or not been your students. And I think we shall carry forward this wisdom in our practice. Thank you very much, sir.
Thank you. Thank you. Thanks, everybody. Thank you. Bye.